things in here that came as a surprise. One of the big things is I'm more prone to chronic inflammation. I'm genetically more prone to have chronic inflammation. And so that kind of came as a surprise. It's great knowing that information, so now I can make a plan to kind of reduce that. I've probably been living with a degree of it for most of my life and just thought that was normal. But now that I know this information, I can implement things that maybe will help reduce that, and I can live better or feel better. One of the big things with chronic inflammation is omega-3 fatty acids. Eating a diet rich in omega-3 fatty acids, fish, kind of a Mediterranean diet, fish, nuts, supplementing with omega-3s. I supplement already with about 2 grams of omega-3s. Might consider actually increasing that a little bit and see how that affects me. The other thing with inflammation is I want to make sure I'm eating a diet rich in antioxidants, berries, making sure that I'm supplementing with antioxidants, supplementing with B vitamins, kind of help reduce that inflammatory process. So that was really informative. I'm actually glad I learned that. I'm glad I took this test because that helps me realize that. Making sure that I'm eating a anti-inflammatory diet, minimizing the amount of omega-6s I'm eating, which are considered to be inflammatory. Find some of that in saturated fats, red meats, also in a lot of processed foods. So I think it's real important for me to start limiting the amount of processed foods I eat and kind of minimizing a little bit of the saturated fats that I eat. Most of our diet nowadays has a lot more omega-6s in it because of processed foods, which leads to much more inflammation. So I'm going to start focusing on more of an anti-inflammatory type of diet, which is commonly referred to as kind of a Mediterranean type of diet. Small amounts of seeds, a lot of leafy green vegetables, broccoli, Brussels sprouts, cabbage, stuff like that. So eating a lot more higher fiber leafy green vegetables, and then reducing some of those omega-6 processed types of foods, seed oils, stuff like that. So if you'd like to have insights like this that I've gained through taking this genetic test, come on down to Dakota Pharmacy. I'd be happy to help you. We carry these tests. We have them in stock. I can sit down with you for a few minutes, decide if this is right for you or not, get you swabbed, and get the test sent off.